Yeah, so hi all. So I'm just gonna basically give a little quick breeze through what I propose my PhD to be over the next 3 years. Some of the kind of main reasons why this research is necessary, and I'll touch on a little bit about how we plan to go about the first study at least, and how the whole overall picture looks. As I've kind of put on the screen as well, my supervisory team consists of Dr. Alison Purvis, who's my DOS, and then Dr. Helen Humphreys and Dr. Catherine Homar, who are secondary supervisors. So as I said, like, contents of the presentation will be like the overarching PhD aim, some of the links and dissemination that I've set up or I'm in the process of setting up, and some of the rationales for we plan to achieve each objective. So kind of straight off the bat, like the topic in general, why this is important. So gestational diabetes is a really common pregnancy complication actually. And in the UK, it will affect around 16% of pregnancies. That's high in itself, and there's a lot of issues associated with gestational diabetes in pregnancy. But specifically with the focus of this project, quite a recent paper, I think it was a year or two ago, it was published, found that there was a 10 times increased risk in subsequent type 2 diabetes mellitus. So there's many reasons why they think that might be the case, similar mechanisms, but ultimately that risk is there. So actually intervening in women who've had gestational diabetes could help with reducing development of type 2 diabetes, which is a big cost to the NHS and in general is a strain on the healthcare system. And actually, so the Priority and Partner Setting Partnership, along with the James Linley Alliance, I believe, well, they did a lot of work recently. They basically found that preventing type 2 diabetes after gestational diabetes was one of their top 10 research priorities that they found. So they asked a lot of healthcare professionals and women who've had gestational diabetes where they think there are some questions that need to be answered, and they also consulted the literature. So this is quite a pressing topic and has been identified as a gap in itself. The highest risk period of development of type 2 diabetes is within the first 5 years, and actually 17.1% of women will go on to develop type 2 diabetes within the first 12 months. So actually intervening in that postpartum period is quite important. And specifically, as I mentioned in the title, we're looking at minoritized communities. Well, non-white women have a higher risk of developing type 2 diabetes after gestational diabetes, as well as having a higher risk of gestational diabetes. So for example, 61% of South Asian women will go on to develop type 2 diabetes after gestational diabetes pregnancy, whereas only 25% of Caucasian women will. And that's still high, and it is still an implication. But focusing efforts on South Asian women within 12 months of a GDM pregnancy could actually be useful for preventing type 2 diabetes, since this is a group that are at a higher risk and also have several other risk factors involved. But the overall aim of the PhD is to identify the realistic opportunities for the prevention of type 2 diabetes in postpartum South Asian women who've had gestational diabetes. And I'm hoping, depending on budget, to be able to use patient and public involvement throughout the research, as I do think this is really important given the nature of the research. Some of the links, as I said, I'd discuss. So I've set up, I am a volunteer with Diabetes UK anyway. I'm a speaker volunteer, and I also attend, they've got a bi-weekly gestational diabetes group where they have women who have gestational diabetes coming in for support and just being able to discuss with each other in a safe space. And then there's also GPs and midwives that come in there and can give advice. So I volunteer there anyway, but Diabetes UK are quite interested in the research, as they've actually got this big push looking at gestational diabetes and supporting women during and after gestational diabetes, given that increased type 2 diabetes risk. So they've also said that they're happy to help set up a PPI group. In terms of the South Asian Health Foundation, I spoke to them probably about a month ago, and they were really happy to help disseminate anything we find. And they've got several good connections as well. And then Better Start Bradford are probably going to be quite instrumental in a lot of the project, because they have really close links with South Asian women who've had gestational diabetes in sort of different areas in Bradford and through clinics there. So they will be able to help us with recruiting for some of the main studies. So when I talk about the main studies, this is one. So the first objective would be using qualitative interviews to uncover postpartum challenges in adopting lifestyle changes in UK-based South Asian women with previous gestational diabetes. So this is kind of the rationale why. Type 2 diabetes can be reduced by over 50% using lifestyle changes. So that would involve like looking at diet in terms of incorporating more fiber, whole grain foods, just the general healthy eating advice, increasing fruit and vegetables, as well as exercising more, whether that's just increasing general activity or training harder. So actually, when you look at those lifestyle interventions and how effective they are, in women with previous gestational diabetes, it has the potential to delay or prevent 1/6 of total type 2 diabetes cases. So that's quite a large amount, especially when you think population-wide and cost-wise on the NHS. However, from pre-pregnancy to postpartum, exercise tends to decrease. Generally, that's a lifestyle pattern that's observed. But also it could be because there's specific barriers that occur. You know, there's a huge life transition. There's a whole other shift in focus and role and identity. And actually, diabetes prevention programs don't really address these. There was recently a paper published that evaluated and looked at some of the general type 2 diabetes interventions. Most are aimed at people who are maybe in their 50s or 60s. Even the NHS Healthier You program, even though women with gestational diabetes or who've just had gestational diabetes, then now that recently became an eligibility criteria for the Healthier You. But the Healthier You was initially designed for an older, not old population, but older population who maybe don't have the same constraints and barriers that someone who's just finished a pregnancy has. So that might be why potentially it couldn't be as effective in these women, because it is quite time intensive with little childcare opportunities. And then when we look at qualitative literature, there was a recent systematic review. It was a global systematic review looking at barriers and experiences of women after gestational diabetes. So anyway, that literature is quite sparse in the UK. Only one study was identified. And actually within that study, I think it was 10 South Asian women out of a total of like maybe 80, 90 women that ended up being included. It was quite a large one. But obviously from other literature, we've seen South Asian women experience unique barriers and different support needs. So there is a need to kind of focus on South Asian women and see if there's any differences compared to, you know, what exists currently in qualitative literature about barriers and support needs. And actually, because we know that in general, culturally, partner and family views can be quite important within the South Asian community, being able to interview partners and families as well within that qualitative study would really like give more detailed and rich information about that social structure around South Asian women. So the acceptability of lifestyle changes to postpartum South Asian women and their families in the UK, as I've said, requires investigation, and that's what we're hoping to do. In order to do that, I've just kind of briefly put on how we're thinking of doing that method. Initially, we wanted to do something mixed method, so that would be including a survey. Having spoken to Better Start Bradford, they've kind of said that that would need to be a very basic survey, so yes or no, or a very basic scale. So I'm obviously in the process of thinking about that, but waiting for feedback off my RF1 before any solid decisions are made. But ultimately, the goal is to get really rich, detailed information, especially about thoughts, experiences, feelings. So we want to interview South Asian women, probably in quite an early postpartum period where they may be feeling overwhelmed, although it might need to be delayed for ethical reasons. But even if we can't see them face to face because of COVID, we should be able to do that even easier for these women over the phone or over the internet, so it's less of a burden for them to try and find childcare responsibilities to come in. And then from that interview, I'm hoping to snowball. So if a woman has said like her partner was instrumental in her, say, diet and exercise behavior, asking the partner to then come in and interview them and get more of an understanding of their thoughts and experiences could be quite interesting. And obviously, as I said in the get-go, we'd want to use PPI throughout this research. So I'd hope to use PPI to develop some of those interview questions, as well as maybe cross-checking some of the analysis depending on budget. Then the second objective that we're hoping to achieve is building a causal loop model mapping the system influencing lifestyle changes in postpartum South Asian women with previous gestational diabetes. The reason we want to look at this is taking a systems approach, which kind of argues that single level interventions could widen health inequalities. Single level interventions, of course, have their place, but specifically in South Asian women, there has been research to suggest that cultural, social, and economic determinants of health can be quite important. So there needs to include some focus on these as well. And integrating a system-wide approach could be more effective, especially with relevant stakeholder consultations, because you can kind of start to think about where things are interacting. So if we were to intervene in just, a woman, would that work and why? What are the kind of constraints and contextual factors around that? Mapping that system would be that first step in identifying some of the synergistic opportunities for system-wide interventions. I wouldn't be creating an intervention myself, but the idea of mapping is that you start to look at the actual interactions and links that potentially, if I'm focusing on social links, or very broadly a bit of social, including with the medical links, that might be inherent there, you'd get more of an idea of like the context and where certain interventions may be more effective. And then the third objective would be developing program theories to explain the context and mechanisms which lead to successful lifestyle changes of South Asian women. So I kind of came up with this question because I was starting to see a pattern in that some population level impact, it's kind of comes off of having a combination of reach, fidelity, and engagement in interventions, not just intervention effectiveness. And a lot of the studies that kind of seem to happen, we're looking at intervention effectiveness. And actually, when you look at minoritized communities, the reason why potentially there's less reach and fidelity is on our part, is not creating interventions that can be accessible. So understanding what works for who and under what circumstances could help reduce some of that effect to increase that population level impact further on, which I think is really important, as well as making, like, bridging that health inequality gap, as we've seen with COVID, has just been immense. And then the final objective we have is to co-produce recommendations for where lifestyle changes may be successfully supported in South Asian women with previous gestational diabetes. As I said kind of before, I'm not looking to create an intervention or put in an intervention and see if it's effective. I'd much rather get a really detailed, rich understanding of what's going on, so that someone who has a lot more resources and a lot more time could then develop an intervention based on these recommendations and use more of a system-wide approach rather than another single level intervention, but also taking into account the wants and needs of South Asian women themselves, which is important when you think of systems level approaches, and knowing the context that things work and also in who is quite important. And then you look at the multi-level opportunities, as I said, if there's any social, cultural interactions, and finally some of those further considerations for underrepresented communities. Just to finish off, this is just as I've tried to make a visual overview of the PhD. So I'll have to, as I said, with understanding what works for who and in what context, that'll be more of a realist angle. So initially that will be having to develop some initial theories, which I'm hoping to start doing with a literature review. The literature review itself won't create those theories, but it will just give a lot more information when it comes to trying to develop those initial theories. Then I'd look to refine those theories using some of those qualitative interviews. And as I said, I'd be using PPI within that, as I explained. And then further refine those theories, it'd be testing and refuting what we're thinking is happening. And building that systems map is quite a good way of doing that, because you see a lot of the interactions that may or may not be happening, and using PPI to kind of fact check that or sensitivity check that can even further refine those theories within those contexts. And then hopefully I'll end up, as I said, with those recommendations based on some of those final theories. So I'm happy to take any questions or comments.